it is true they had gone on what? On a go-slow. But we have resolved it. And we have resolved it not because of their go-slow. It was something that was already in the process. There is a CAB memo awaiting cabinet what? Approval. Because you see, initially, the allowances that the healthcare workers were being paid at these centers was money from the national government. Now, the national government has pulled out. So it is now individual counties to see how they can what? Bridge the gap.
They have promised us that they'll be looking into the welfare of the staff, and from within a period of 2 weeks, the frontline workers in this particular facility will be receiving their allowances, and they'll actually be receiving airtime as from tomorrow.
Now the issue to do with the airtime, we had already solved that problem, but the problem is delay in the transactions between the treasury and the Safaricom suppliers.
The welfare of the staff if they get sick, and we agreed that we'll still have spaces for healthcare workers to be treated for COVID-19 at Kakamega General Hospital, including the transportation of the healthcare workers from the place where they are staying up to this.
Any healthcare worker who gets infected in the course of what? Their duties, they are taken to CGH. So CGH was originally meant for healthcare workers. Up to yesterday we had 98 health workers who had been infected. 98. COVID-19 is real and is with us. Prominent fellows have gone to this pandemic. You know them. Some have been buried, others are yet to be buried. Let our people not assume that it is the type of talk they had initially during the first wave. It is here with us. And if you look at the infection rate, you will even be shocked. And this time is not about big people in the society. It is anybody in the society. In fact, there are so many people just collapsing and dying, and they are buried without what? Without sample extraction and testing. You wouldn't be surprised that if those guys were tested, you will discover that it is what? It's corona. So let our people be very, very careful. Let them wear masks at all times. Let them keep social distance. If possible, avoid crowded places.